Across the United Kingdom and Ireland, there are no less than 5 different systems of public health control, and yet, thus far, not one of them has tamed COVID. We asked the question, how has it failed so far? Can it work in the future? With Dr. Bharat Pankhania and Professor Sir Harry Burns. Join us on the Alex Salmond Show, on air and online. I want to start today's show with a reflection on the passing of Sir Sean Connery. Screen legend, the world's most famous Scot, the definitive Bond, demon golfer, Sean Connery was all of these things and much, much more. To me, he was a loyal, steadfast friend over more than 30 years. When I took this show on some 2-3 years ago, the one person I really wanted to interview was Sean Connery, and he readily agreed, but circumstances in health have prevented that happening. And the reason was that of all the interviews that Sean did over the years, all the things that were written about him, I only read one from the Scottish author Willie McIlvanney, which got close to capturing the essence of Sean Connery. Because this was not just a great personality, a great movie star. This was a great human being, a deeply, deeply humanist, funny, ironic human being, with great views on life and everything else, and never frightened to express them. In my life, I've been privileged to meet a few great people, but only a few. And one of these was Sean Connery. Now, in times to come, we'll get the opportunity to do a proper tribute to Sean. But in the meantime, for Lady Michelin and the family, our condolences. For the rest of us around the world, a light has dimmed in our universe, but it will shine on in our memories and hopes for the future. Goodbye, Sean.
This week, in a screeching U-turn and in an apparently chaotic manner, the Johnson government announced a new month-long national lockdown in England starting today. But this is a lockdown with a difference. Schools, universities and key workplaces remain open. Hospitality, house parties and holidays are forbidden. Elsewhere across these islands, things are different. Wales is already a week into a much stricter 2-week lockdown, while Northern Ireland is halfway through month-long restrictions. Scotland this week saw the introduction of a 5-tier regionally based system. Today, we ask 2 public health experts whether these measures can tame the virus across the UK while the world awaits the vaccine. Professor Sir Harry Burns, the former Chief Medical Officer of Scotland, is the new President of the British Medical Association. He is in a unique position to assess and assesses whether the virus can be brought back under control through these tighter public health restrictions. Dr. Bharat Pankhania of Exeter Medical School has over 20 years' experience in communicable disease control and infectious disease control. He worked as a consultant in communicable disease control for local authorities and Public Health England, the agency which is now being blamed by UK government ministers for the failures of test and trace. Alex will be in conversation with our 2 guests later, but first to your messages, tweets and emails on last week's show. Last week's show on Black History Matters excited great interest and many responses. We hear first from Ian Patterson, who says, all history matters, but I wouldn't pull down any statues I didn't like. Ian Marshall says, the problem isn't history, the problem is who the history is written by or presented on TV. And on the subject of history, Lorraine says, we never got taught Scottish history when I was at school. Donald says, there is another amazing black lady, Mary Seacole, Jamaican Scot, that massively helped medicine through better hygiene during the Crimean War and every bit the equal to Florence Nightingale. Richard Lindsay says, excellent show. John Barnes, always the voice of reason when talking about racism, really put a lot of people in their place when Liam Neeson spoke of his experience. I admire Barnesy a lot for his achievements both on and off the field. And finally, Nelson says, Jock Tamson, a name that will forever remind us that we are, all of us, and of whatever origins, of equal value, common in the culture of Scottish people. Now, over to Alex with Professor Harry Burns and Dr. Bharat Pankhania.
Sir Harry Burns, we now have a renewed lockdown of sorts coming in England. We've got a circuit breaker in Wales, and Scotland has a five-tier approach. Why is it so difficult to get the key messages in public health across and get this pandemic under control?
I'm about to say something that I wouldn't often say, but I've got a lot of sympathy for the politicians. And the damage that's done by lockdown is significant, and governments are having to find a way of balancing it. Now, I think Wales, Scotland, Northern Ireland and so on have all adopted slightly different approaches. I think Scotland began a partial lockdown, if you like, in the areas that have the highest rates of transmission some time ago, and we're now beginning to see that working. I think England has waited a bit longer, and I think they've had to impose stricter outcomes. So it's about trying to do the best you can in the circumstances you've got, but I just think that England have probably waited a bit too long, to be honest. What's happening in the north of England is really very significant at the moment.
Dr. Pankhania, you've said that in terms of real epidemic control, you have to administer it and deliver it at local level. What did you mean by that in terms of England in particular?
Well, what we need is local experts, and we do have them. So local authorities have all the consultants in public health there. And then we also have the local Public Health England equivalent in the other nations, experts in communicable disease control. These are the key players. They are the linchpin, the commanders in chief, and they should be leading their outbreaks locally because they have the network, and the network is with the hospitals, the laboratory testing, the environmental health officers, and they know if there is a rising tide, if there is quiet, if there is calm, or if there are concerns, and they can respond very dynamically on a day-to-day, hour-by-hour basis, and therefore they should be meeting every day, and you have it as a command control center run locally rather than from far away, London or elsewhere.
Harry Burns, why has there been so much difficulty in getting test and trace operating across these islands? I mean, we've heard this week that Slovakia has tested half the country in 2 days. Now, this is November. The virus started spreading earlier in the year. Why isn't that sort of thing possible in the UK?
You're absolutely right. It's very frustrating, and I feel quite frustrated about it because I started talking about this way back in March. We are told that availability of the tests is limited. We're told that the process that's involved in testing and then analysing the stuff and then reporting and so on is difficult. I'm just not convinced that the management of the whole process has been effective. And a lot of that management has been outsourced. I agree absolutely that local public health is the way to go here. Right from the beginning, in my own university, we were offering opportunities for rapid tests and so on, but we were told, no, the government wanted to do this particular way. And I just don't think it's been well managed. I really don't. They say, I spoke just last week about improving testing up here, and I was told that the kind of tests that I was suggesting weren't available and so on. There's no reason why they shouldn't be available because other countries, as you say, are doing it. So it's very frustrating, and it's the way out of this. Test asymptomatic people, find out who, although asymptomatic, is carrying and potentially spreading the virus, and isolate them. That's the way to control this and get it clamped down very quickly.
Bharat Pankhania, the testing at local level, I mean, what's wrong with these big lighthouse testing centres that the government have established? I mean, why aren't they capable of doing the job on a scale that's necessary to meet this crisis?
Well, it's also a scattergun approach. The scattergun approach is, we've said, all floodgates open, go and get a test. Well, that's not the way to run a outbreak control. Give you an example of when we dealt with the swine flu pandemic. We met with the laboratory staff every day, and we could work out where the pinch points were and how we would run the operations. Whereas when you've got a faraway lighthouse lab, it is doing it at scale, but it is not responsive locally. It can never be responsive locally. And then we've introduced what you would call failures of communication. The NHS labs, at the touch of a button, would have alerted the patient, the GP, the hospital, and any other place it needed to inform about the test result. Here, we've had to set up and create new networks with new permissions to enable all these communications to happen. So a number of things have gone wrong. If only we had stayed with what we know works best.
So Harry Burns, Scotland and England for that matter, we originated public health controls of infectious diseases. So why can it be that having that resource of knowledge over the years, we found this particular virus so difficult to get a hold of?
I think in part it's due to the fact that this virus is very, very infectious and spreading very widely. I mean, when we managed to suppress the number of cases down in March and so on in April, and then we got sporadic outbreaks, local public health departments were very, very effective. And then we lifted the restrictions, we opened up hospitality and so on, and it began to spread like wildfire, and local public health departments became quite overwhelmed. A lot of the guys I speak to are literally being run ragged by what's happening. So we need more extensive controls, but critically, we need people to adhere to those rules. It is so frustrating to hear people say, oh, we don't care, this is terrible, all these rules, we're just going to go out and we're going to have parties, we're going to have Christmas together and so on. If you meet with people and you don't distance and you don't wear masks and so on, you increase significantly the spread of the virus. And it is basic public health.
Bharat, Pankhania, you're teaching classes remotely and online at the present moment. Your students, presumably, this is a tragic and serious condition, but presumably your students must have views as this as a tremendous example of a living, real-life example of what it really means to be in a pandemic situation. Are you teaching about the case as you go on at the present moment?
Yes, I am. So I take liberty with deviating from my brief of what subject I was covering to say, I will cover that subject, but let's cover this right now whilst the iron is hot. And we've started doing even tutorials late at night at 10 o'clock. We meet, we discuss, and we move forward. And it's really good to the students who are joining us. So they are learning in real time, and they will grow up to be experts. They are also bewildered and concerned and not sure about why we've had so many ambivalent messages. So when I tell them that in an outbreak, you need a commander-in-chief, and the commander-in-chief does the following, and this is how you do it. You get all the people around the table, we discuss the strategy, and then we do it. And then my students say, how come England or United Kingdom isn't doing it in that manner? And I say, well, when politics and health interfere, it becomes difficult.
So Harry Burns, we took that down to cases. There's been a lot of talk about the students going back home for Christmas, those students who've gone on to campus. Would that be an example of where you should have a mass test of all of these people to make sure you're not releasing back into the homes around the country, indeed around the world, people who are asymptomatic but infected?
Yeah, I think that is a very significant risk. The asymptomatic testing, I think, is essential to stop spread continuing over the winter and so on. I mean, it's not that difficult. One of the things that we proposed very early on was testing wastewater from halls of residence. There is evidence that the water, the effluent from any building and so on, if anyone in that building is infected with coronavirus, you can pick it up in the wastewater. So why don't, there are 300-400 students in a hall of residence, test the wastewater. If you get a positive case, you have to go in and test more students in the place. But that was too difficult.
Join us after the break, where we'll look at how the experience thus far can translate into perhaps better practice over coming months to get this virus under control, and we'll cast our eye internationally as to which countries have been most successful in tackling coronavirus. Join us then.
Welcome back. Alex continues his interview with Dr. Bharat Pankhania and Professor Sir Harry Burns and asks the question, will this really all be over by Christmas?
Dr. Pankhania from Exeter University, would you say the public are really understanding the public health messages? I mean, there's been a lot of delivery of them, but are the public really taking them to heart thus far?
No, and it is very disappointing. We've had so many mixed messages, and I feel now the public also have got messages fatigue, and they are consciously or subconsciously switching off. We need to have our act together and get simple, clear, understandable messages, not too many layers, not too many tiers. Just get the simple, straightforward public health messages out there and repeat them, reinforce them.
Harry Burns, it's generally said, and I think accepted, that communication, at least, of policy has been better in Scotland than elsewhere, certainly in England, perhaps. Can that communication be improved further to try and drive these messages home?
I think so. I think part of the problem in England has been they've changed tacks so often. We're not going to have lockdown. No, we'd better have a lockdown, this kind of thing. So people become a bit confused and frustrated. The Scottish Parliament is closer to the people. The people of Scotland have better access to their politicians, and that's very helpful. People see the politicians, they see the clinical director, they see the chief medical officer and so on very regularly explaining things. Our national clinical director, Jason Leach, for example, he appears on sports programs at the weekend, on phone-ins and so on, taking people's questions and this kind of thing. So there is more accessibility in Scotland. It's difficult policy, but as I said at the beginning, ministers are trying very hard to keep the economy going as best as possible while suppressing the virus. And I have to say that I think they're probably right in trying to achieve that balance in the way they're doing it.
Can I ask Harry Burns, why have so much been outsourced to private companies in terms of testing? I mean, there's many stories of retired health professionals volunteering their services to help with this and not even getting an answer, while the private companies have been given shed loads of money to do things perhaps not very well.
I think it's outrageous. I really do. I think that we have experts around. We have, as you say, retired people. We have volunteers who want to do test and trace and so on, and yet it's going to these private organisations. And I think we need to know how much is being spent on that. I suspect that more is being spent on this in England than in Wales, Northern Ireland or Scotland. But there just feels like a lack of overall management to this very complex process. It could be done more efficiently and more effectively, I think.
Is that frustration in England, Dr. Pankhania, that this privatisation of test and trace is happening while many local authorities, as we've seen from recent weeks, feel themselves dreadfully under-resourced in terms of the local public health effort?
It's a disaster and it's outrageous. So I agree with what Sir Harry Burns just said, because why? Why do you want to set up a private testing laboratory and a private contact tracing service, which will never, ever work as efficiently as if you had invested in your local NHS services and systems in both the local authority, in the NHS, and in Public Health England? If we look at the staggering amount of money spent £12 billion. That is the equivalent of the entire budget of all the GPs and public health combined. Now, if we had used that money to instead set up systems, contact tracing systems in local authorities, in local public health England areas, we would have an asset to the nation, an asset that can be used 18 months, 24 months from today. Because when we have sporadic outbreaks, we will need local laboratory capacity and local outbreak tracing services. We won't have the centralized systems in existence then. So we've lost an asset to the nation. It is a big mistake to have made.
Now, Dr. Pankhania, if you cast your eye worldwide for a second or two, which are the countries that you feel have had the best record thus far in getting a grip of this pandemic?
South Korea, without a doubt. And if you look at the South Korean interventions, it was early. That's the key point. Early, hard, fast, and strict. So they went in early with their control measures. They went in hard, meaning no half measures. And they were strict about enforcement and making sure you wore your mask, you took infection control seriously. And now look, they sorted out their health. And as a result, their economy is also sorted out. So I mirror what Sir Harry Burns was saying, which is you sort out the health and you will sort out the economy in tandem. So to tell me as a health person, the economy is being trashed, I disagree. The economy is being trashed because you fail to sort out simple public health measures to make both economy and health run in tandem together.
And Sir Harry Burns, your favourite example from around the world presently that we could take real lessons from?
Well, I agree that places like South Korea and so on, and Japan and so on have done very well. But the interesting places for me are places like Australia and New Zealand, where lockdowns have been very successful. Interestingly, in New Zealand, it's clear that the people have been very trustful of their government. So this, suppressing the virus through lockdowns and these kind of things is one thing, but the other thing is having public confidence in the process. And places like New Zealand have definitely shown that to a high level.
Dr. Pankhania, we've had this renewed lockdown in England. We've got the 5-tier system in Scotland introduced earlier. But in Wales, they've pursued what they call a circuit breaker. Now, do you think that Mr Drayford in Wales is going to have success as First Minister in getting a grip on the virus with that circuit breaker, or is he going to have to continue that over a longer period to get the virus under control?
I think a longer period is also required because Wales is not an island within an island. And therefore, whatever happens in England will translate into Wales as well. And therefore, I personally would like a unified public health approach across all the nations. It is unfortunate that we have one version in Scotland, Northern Ireland, Wales, and then in England. So because Wales is a very close neighbour of England and the population is in England, there will be movements. And when there are movements, whatever happens in England will also happen in Wales. Therefore, we need to synchronize the control measures in both the countries at the same time. Otherwise, you are hurting one economy whilst the other economy creates all the cases, which will then come and infect your people that you were trying to prevent from getting infected.
Well, Sir Harry Burns, there's a call for a unified policy across England, Wales and Scotland. Would that work?
Well, I'm just thinking at the moment about the tiered system in Scotland, and I know that some epidemiologists are suggesting that the tier 3 areas like Glasgow and the Central Belt have stricter rules that will control more effectively what's happening in those areas. The tier 1 and 2 areas will continue to see problems, and they will gradually go up to the point where they will need stricter rules and so on. So that is an argument. If that actually is what happens, that is an argument for consistency across the UK.
But what happens if the consistency is the wrong policy, as perhaps, given the number of changes we've seen from Prime Minister Johnston, that might well be the case?
Consistently effective is what I'm suggesting. We need to be quite strict about it.
Yes.
So, Harry Burns, if I can ask you to put your hat on as President of the British Medical Association for a second, are these the global matters that your members are thinking about, or are they so immersed in the immediacy of the crisis that they can't look forward to see what's to come?
I am working with Royal Colleges and so on to begin to think about how we prevent this happening again. That the mortality is much greater the lower down the socioeconomic scale you go, and that's just another argument for dealing with inequality in our society. So sustainable development, an economy that works to provide well-being for everyone in society is the long-term objective for this, and we mustn't miss the opportunity to make that argument.
Tell me, Dr. Pankhania, the politicians seem to be focusing a lot on Christmas. That's understandable, it's a great family occasion, but presumably a virus doesn't recognise religious festivals or any other time of the year, does it?
No, of course not. And I'm concerned that we are already giving out mixed messages. Christmas 2020 cannot be the same as all our Christmases. My advice is, look, advise people now that you need to have fewer human contacts for Christmas 2020. Invest in yourself so that you are well, able, and in good spirits in 2021. That's the way to go.
I absolutely agree. You get this virus through close contact with other human beings. And therefore, for the first time ever, we are not going to have a family Christmas party, for sure. We will have our Zoom call with the family, and that will be what we'll do. It's stay safe, stay isolated, stay with your mask and hand washing and so on, and you will be safe to enjoy next year.
Sir Harry Burns, Dr. Bharat Pankhania, thank you so much for joining me on the Alex Salmond Show.
Thank you.
Thank you.
Many countries have struggled with handling COVID, and most Western European countries have sleepwalked into a second wave of the deadly virus. What is most disappointing is that many of these countries actually pioneered public health control in the days when infectious diseases were most often without cure or effective treatment. So why has it proven so difficult to implement disease control or an effective test and trace system? And why is it so difficult to deliver clear public health messages with all the advantages of modern communications? And why has it not been possible to copy the success of the Far East countries who honed their public health systems in response to SARS, Vietnam, China, Singapore and Japan, or Australia and New Zealand, or the Nordic countries in Europe, or Canada in North America, or Venezuela and Uruguay in South America? To a greater or lesser extent, these countries have tamed COVID. So why not across the British Isles? Across the UK and Ireland, there are now no less than 5 renewed but separate policies of disease control underway. And indeed, in a few weeks' time, we'll be looking at the success or otherwise of the measures in Ireland North and South, which are halfway through their implementation. This, at least, will have the advantage of giving an insight into what works, and even more importantly, what does not. On these lessons, much depends. But for now, from Alex, myself and all at the show, stay safe, and we hope to see you again next week.